Assalamualaikum. My name is Azanatul Imam binti Zulkifli, matrix number L22A0086. So I will be explaining about the first question, which is 4 stages of crisis model. The first one is prodromal stage, which is people has been getting mild fever, cough, sinuses and headache, but nothing too serious. People did not take action about it because they feel like this is a normal thing that they face every day. The second one would be acute crisis, where things are getting serious and government had detected the virus and people has realized that this is a serious matter and not thing to be played with. The third one is chronic crisis stage. This is where vaccine is introduced and all citizens are compulsory to take this vaccine and also booster shots. The fourth one is a resolution stage. This is where people think that everything has been resolved and everything is back to normal. But for this crisis, which is COVID-19, it is not entirely back to normal. There is still a few guidelines that people need to follow. The second one is risk and crisis communication strategies. There is 2 strategies, which is image repair theory. So image repair theory is where one party is valuing their image more than the situation or the crisis that are being handled that are happening in their surrounding or environment. The second one is decision and diffusion theory. Decision theory is when they make a decision according to the situation that are being handled. So for example, in COVID-19 case, it's when the government is giving order for MCO, or the name is movement control orders or lockdown. So diffusion theory is when they make decision, but they check first whether the decision that will be made is useful for the citizen or not. For example, is wearing masks will help citizens to reduce the possibilities for them to get COVID. So if yes, then they are going to release a statement by saying that all people need to wear masks when they went out nowadays, or putting hand sanitizer on their hand or sanitizing their belongings will help them from getting COVID-19. Number 3 is crisis scale and scope and resolution effectiveness. So in scale, COVID-19 transcended the boundaries of local or regional crisis, emerging as a global pandemic. It affected almost every country across the globe. So with this and the scale of the crisis required unprecedented global coordination and response effort. So for scope, COVID-19 had an extensive impact across multiple sectors, reaching far beyond just health. The healthcare system faced immense pressure, with hospitals becoming overwhelmed by the surge in patients, necessitating makeshift facilities and exhausting medical supplies and personnel. The economy took a significant hit as businesses were forced to close, leading to job losses, reduced incomes, and unstable market.
The article explored the pandemic shift in risk and crisis communication within the aviation industry post the COVID-19 pandemic. It's divided into the methodologies adopted by airlines to communicate effectively with stakeholders, manage the risk, and ensure the operational continuity during after the pandemic crisis. Long-term impact analysis. Okay, for the first one is impact on organization. Restructuring. Many airlines undertook the significant organizational restoring into the minimizing cost and streamline operation. These include downsized staff, closing and non-external routes, and evaluating partnership. Innovation in safety measures. Airlines adopt advanced safety protocols like touchless check-ins, covered sanitation process, and contact monitoring to ensure that passenger safety and regain trust. Digital transformation. There was a marked evolution in the adoption of digital solutions. Airlines invest in mobile apps for seamless booking, customer service chatbots, and AI for predictive maintenance for aircraft. Second, impact for stakeholder, employees. Job cuts and forgiveness creates a significant impact on employee morals, financial stability. Airlines had to focus on transparent communication and support programs to retain the trust and engagement among remaining employees. Second, passenger. Increased health and safety measures through the reshoring also hide the travel anxiety and leads to demand for flexible booking options and refunds. Clear communication become critical to negating the concern. Investor. The financial investability require robust risk communication to reassure investor about recovery strategy and future stability. These include the detailed financial, disclosed and future-oriented risk management. Impact on industry. Regulation change the pandemic supports strict health regulation, including mandatory vaccination and testing for international travel, which fundamentally altered operation protocol within the industry. Second, collaborative efforts. The industry saw the increased collaboration with healthy authorities to implement the safety measure and vaccination drive, making the health, security and central focus. Market shift. The crisis lead to the market in shift dynamics with a smaller, more airlines. Airlines sometimes outperforming large legacy carriers due to their ability to quickly adapt to new regulation and consume demands. The COVID-19 pandemic underscored critical gaps in global crisis communication and preparedness. Okay, for the first one, early the transparent communication, trust building and preparedness are continued upon the leaders sharing acute and timely information for the outside. Second, coordinate global response. Fragments efforts lead to the instability and great chaos. A unified international approach with a consistent messaging is external. Third, public education. Combating misinformation require a robust and structured public education campaign, delivery clear guidelines and debunking myths effectively. Four, adaptive messaging. Diverse population necessity tailored communication strategy. Message should be customized to different culture, age group, and language to ensure the comprehension and compliance. Lastly, flexibility in communication plan. Static strategy fails in dynamic crisis. Communication framework must be fluid, capable of evolving in the real time to address emerging challenge. In summary, the pandemic has demonstrated the real-time update transparency, adaptability, and constant global effort are critical. Moving forward, these elements must be integrated to crisis communication strategy to ensure a better management and mitigation of future global crises.